Good afternoon, everyone. It's my pleasure to welcome everyone to Diabetes Sisters Life Class webinar, Candid Discussions about Diabetes and Eating Disorders, Part 2. My name is Anna Norton, and I'm the CEO of Diabetes Sisters. I will also be moderating today's webinar. I'm really excited to welcome back Dr. Ann Goebel-Fabbri in leading this important conversation. As women living with diabetes, we're more likely to develop disordered eating patterns or clinical eating disorders. And for many years, this challenge was not addressed by healthcare professionals or even patients. Today, we're really fortunate to work with teams to help us better understand these patterns and help guide us through these treatments. Anne is a clinical psychologist, researcher, and author of Prevention and Recovery from Eating Disorders in Type 1 Diabetes, Injecting Hope. She's dedicated her career to understanding the relationship between diabetes and the emotional toll it sometimes can take on our lives. Asha Brown, who's also joining us today, is the founder and executive director of We Are Diabetes, where she works with families, patients, and health professionals across our country. She uses her personal experiences with eating disorders and diabetes to offer hope and support to those still struggling. She also establishes relationships with eating disorder facilities and diabetes organizations across the country to help connect people to appropriate care. She's presented at various diabetes and eating disorder conferences and writes for numerous websites, including Diabetes Health, Diabetes Daily, and Beyond Type 1. Please welcome Anne and Asha to lead us on this topic of diabetes and eating disorders.
Thank you so much, Anna. I think that for both in saying we absolutely love the work of Diabetes Sisters. It's such an important organization, and we're both happy to be here. Can you switch to the first slide, please? Switch to the first slide, please.
And it's switched.
I don't see it. Hold out of this mode. I'm sorry.
Okay. I don't see this next slide either.
No, all we see is the Candid discussion.
Uh-oh. Okay, here we go.
Okay. Is it up
now? Okay, thanks so much.
Yep.
You're welcome. Okay.
So I'm going to try to sort of ground all of us what we know in research so far about inversion. And Asha is going to speak about the experience of being a woman who struggled with disorder and is now in recovery and has dedicated quite a bunch of her time to helping who are still in that struggle. Why disorders and type 1? We do because women with type 1 have almost 2.5 times developed disorder. In fact, 31% to the fact that they've omitted insulin weight loss. Say that they had a frank eating disorder, but that they were using the decrease in and the hyper to that as a way to lose calories in their urine. The problem is that this kind of behavior is incredibly dangerous in relationship to microvascular, and now we know macrovascular diabetes. In fact, a follow-up study I did, which followed women over an period, discovered that insulin restriction threefold increased mortality risk during that period. We're talking about a very, very high stake and complicated women's health issue. Next slide, please. So I've probably heard of this being as diabulimia, and I always talk about this term having pros and cons. My biggest concern about con having only one name, it's creating that women with type 1 exclusively have an eating disorder that involves insulin, which is not always the case. Women with type 1 can have disorders of any, and insulin restriction happens one disorder that is unique only to women with type 1. having this name is clearly that if it has a name, you're not the only one struggling with it. Decrease shame and isolation. And on the flip side, it also raises awareness not in the community of people with type 2 diabetes, also in healthcare providers trying to help. And it creates a way to talk about things, not only with the community itself, but also with those care providers and potentially with family and ones. The con is that this name risks conveying that talking about is exclusively bulimia, in other words, binging and purging through hyperglycemia, and it kind of risk of tying this complex disease, a whole bunch of issues that can come with it. Please. Please. So, thank you. Insulin restriction, why is it such a symptom? So we know that before diabetes is diagnosed, hyperglycemia is the and insulin in the body to regulate that. So the body starts wasting away, and weight loss and muscle and fat stores get eaten away at in that process. So as blood glucose increases, the body attempts to regulate that by urinating out as much as it can. They're starving, they break down fat for energy, and in the most medically serious situation, diabetic ketoacidosis can result, and this can be fatal and typically require intensive. Next slide, please. Next slide, please. So I'm just going to very briefly cover the range of types of disorders that can occur. Anorexia is obviously the one in calories intensely, leading to a body that's far lower than normal and certainly far lower than me. It involves an intense fear of gain despite the fact that they're underweight. The third bullet point is important to think of sort of the whole spectrum of disordered eating, that disturbance in the perception of body and shape, and the person, him or herself, has undue influence on weight shape as self-worth. Now, if you type 1 diabetes, what it very includes perfect blood glucose values. So taking in so little food and so little carbohydrates, the glucose becomes lower and would typically be seen, and it sometimes go undetected. The eating disorder can go undetected until the BMI, the body mass index, becomes low. In fact, I've heard from patients dealing with anorexia 1 diabetes that because their glucose are so low in the early stages of this, they were getting any compliment reinforcement from their healthcare team. Please. Nervosa is the eating disorder. It's characterized by frequent binge eating episodes. Binge eating is defined as eating a larger amount of food than your peers would eat, accompanied by loss of control over that eating. It often comes up then by shame and guilt over doing it, and a lot of weight gain. So it gets followed by purging, and in a person with one of the ways they might purge is to restrict. Next. OSFED is other specified disorders, and what this, it's sort of a bucket where any that is not of diagnosability falls in this. Next slide, please. We're gonna, Asha.
I'm going to jump in now. So first of all, I do want to thank everyone for being here today. Thank you, Anne, for kind of laying out some of the most important stuff related to this topic. I want to share a very quick recap of my story in regards to type 1 diabetes and eating disorders. So you can see this photo. This is a photo of me and my dad. My father is also type 1 diabetic. I was diagnosed with diabetes with type 1 when I was 5 years old. And my diagnosis story was completely uneventful. I showed the symptoms. My dad was like, oh, shoot. They took me to the doctor. They, were like, oh, yeah, she's a type 1. And I started taking shots and I went home. There was no hospital. There was nothing. And I had the most incredible childhood. I actually started my professional film career the same year I was diagnosed with type 1 diabetes. And, the ADA asked us to pose for them and all this jazz. So I share this being said that I did not have catastrophic events with my diagnosis. It was the best one could ever hope for in regards to finding out you have to live with chronic illness. My rebellion towards my diabetes started later in life. And I wanted to kind of lay this out for everyone to understand that no one is safe from potentially developing an eating disorder. I will also say that before we move to the next slide, that I was diagnosed at age 8 with Hashimoto's, which is a very complicated type of thyroid disease. And then by age 15, I was diagnosed with something called PCOS, which is polycystic ovary syndrome. And all of these are all related to autoimmune disease. So by the time I was 15, I was carrying quite a lot of diagnoses around on my shoulders. Anna, next slide, please. So the important thing that there's a few things that I want to explain to everyone because I feel like sometimes people are trying to blame one certain source of why a type 1 diabetic develops an eating disorder. And not only in my personal experience, but now in the experience of working with hundreds of men and women through We Are Diabetes, there is no one contributing factor. These are my personal contributing factors. When I would go to CDEs and whatnot in the 90s, I was given some unfortunate information that was not helpful, that actually exacerbated my thoughts and future behaviors in regards to an eating disorder. I was encouraged to use substitutions instead of learning how to eat a portioned, healthy, normal amount of food. My two examples, so anyone who was diagnosed in the 90s probably went to a birthday party and was given angel food cake instead of a lovely piece of birthday cake. I ate a lot of angel food cake, you guys. And I was taught to avoid eating what I wanted. I was encouraged to pick safe foods, and that really set me up in my eating disorder development down the road. The other issue that I had was as I grew up and was curious about all of my chronic illnesses, I started to read information and all of the literature that I read about my multiple chronic conditions discussed the threat of weight gain and obesity and kind of made it sound like I was doomed to never actually have a healthy body weight. For a 14 to 15-year-old girl who already had a professional performing career, this was a very triggering situation. And I started to feel like I was being any concerns about me wanting to be a healthy size were being dismissed because we had to put my chronic illness first, so to speak. And my feelings about my body and about wanting to, look pretty were vain, and we just were not going to talk about it. And so it made me start to feel a lot of guilt and shame. And it also made me stop sharing and trusting my healthcare team. There was also a major lack of support when I transitioned from my pediatric endo and my pediatric CDE to adult endocrinology. I basically was just floating around to random endos who would just look at my chart. They wouldn't look at me, they wouldn't ask me questions, and they certainly didn't ask me how I felt. So I started to really disassociate from my care. Anna, next slide, please. Anne's she did a great job of covering the fact that it is not just insulin omission when we're talking about diabetes and eating disorders, and that is very much the case with my situation. I presented with a lot of different symptoms from the categories that Anne discussed earlier. I started with food restriction, just because I was reading all this literature about weight gain, so I was like, oh my God, I better. I then started to compulsively exercise, and later through the decade-long battle with my eating disorder, I moved into binge eating disorder, which was also followed with and supported by insulin omission. And that's all the detail that I ever provide about my eating disorder. I don't go into much more detail than that, but it is important for me to stress that I struggled with multiple different types of disordered eating. Anna, next slide, please. So this picture really helps to paint an image and an understanding of how I really felt about my eating disorder and about my diabetes. I felt completely overwhelmed. There was a point I realized that I didn't remember how to actually take care of my diabetes because I had been faking it for so long that I didn't remember how to do it normally. Like, I really was so lost after 10 years of pretending to take my insulin and pretending to do the right thing. I really had forgotten what it was like to take care of myself. And I got to a point where I was suicidal, to be honest. It was a really ironic situation where I had met the love of my life and he'd asked me to marry him. And I was 22 and I said yes. And I had just been cast at one of the most nationally reputable theaters in the entire country. And I was looking up ways to kill myself at night because I was so lost. And I was getting so sick that I could barely perform. And I knew there was a point, at that point I knew I needed help. And I absolutely wasn't able to pull myself out of this on my own. And that is when I chose to seek treatment. And that was the most difficult wake-up call and the most difficult battle of my life. Anna, next slide, please. So here's a picture of me currently where I am happy and healthy for the most part. And there obviously is quite a lot more detail about my story, and I'm happy to share it in more detail with anyone who wants to listen. You can reach out to me later. But what I want to stress is that the three most important things that I had to bring into my life and really use as pillars for my recovery was that I needed to accept treatment. I needed to accept it. I needed to accept my diagnosis of an eating disorder. I needed to accept help. I also needed to surrender. I needed to surrender to the process. I needed to surrender to the fact that things were going to change. And I needed to embrace the fact that I was going to be uncomfortable for quite some time as all of this shifted and as I got better. The long-term commitment that you need for recovery, it's a big deal. And a lot of my clients get very scared that they don't think they can do it, that they are the person who's not going to make it. But I promise to anyone listening, it's possible. It's not pretty, you guys. It's hard. It's really hard, but there's always a light at the end of the tunnel. And obviously I could talk about this subject for hours and hours, but we have a lot more to share. So that's just my little 10-minute spiel, and that's why I'm here today running We Are Diabetes and doing the best I can to help lead others towards the recovery process.
Next slide, please. So this is Anne again. So just as Asha pointed out, everybody's eating is unique in its own way. And I think everybody's process is unique in its own way, out as well. And what I became interested in, that I worked to help them recover from their eating disorders, this issue of why does it work for some people and they find, and even though there's uniqueness among them, common threads that we could learn from, and that are in fact not the experts, that the experts, the men and women with this and who struggle with it and who come out. And so because I really wanted to learn from women who are experts, namely the women who recovery. And so I interviewed 25 women in recovery. They all had 18, so could not be one of my patients, because I wanted it to be neutral, not any kind of role other than asking. And I recruited through this page called Awareness, and Asha helped me a great deal through We Are Diabetes. So they have type a year, an eating disorder for at least, and B for at least a year. And got several volunteers from countries, but because health systems are different here in the U.S., had to limit to just women in the U.S. And if you talk to eating or researchers, both in the community, type 1 community, the idea of how to define recovery is this huge puzzle. And everybody has their own sort of opinion on how to define recovery. This is my opinion, not the end. It just happens to be how I defined it for these women. They had to meet sort of these criteria in consistently taking appropriate insulin, in rigid exercise, not intentionally running glucose. Again, at least we know glucose does whatever it does now. Eating flexibly most of the time and on and feelings. So in other words, it's not that people have eating disorder thoughts and feelings. In the US, you could argue all have eating thoughts and feelings because we've been sort of trained to feel so in our bodies. But it's the not acting on those thoughts important. And the next slide, please. So one of the things I'm interested in is how to getting. You heard from Asha how she moved forward from tipping point where she realized, okay, I can't do. And like it was related to the way the disorder was her ability to perform, something that she valued. And that was true also of many of them that I have a few quotes here that I'll be reviewing. And so the woman named Caroline, none of these are real, and she's subway in city, and I'm thinking, oh my God, I can't. And the experience of chronic hypoglycemia coupled with all sorts of with eating really leave the body so good of energy and so good of health that, you know, the younger women that I work with, they deserve to feel your age. Say someone, you deserve to feel 25, 93, because this is the way that it sort of is the body. People also spoke about relationship. My husband was just like, I'm not raising a child with just like this. You'll lose everything for this. And in fact, at the end of marriage is treatment. There's also this fear of complications. Women with insulin are absolutely clear that this is and that it's dangerous and it's harming. They don't need, they already live with that fear. I could see the future. I'm going to be 32 one day and I'm not going to have legs because of what I'm doing right now. And this is not our Anna we're talking. So what about just to just said it's not pretty, and it's a lot of many challenges that came up. I'm just summarizing these. So anyone who has an eating disorder currently or already believes they are fat and they're not. And so here you're taking a person with emotionally high blood sugars and mass saturation, and the moment they're taking in, their body gets the sense, hey, I better now. I'm finally not needing to be. And there's this massive tension, and the person's skin is tight, feel kind of like a sausage in a casing, very, very uncomfortable physically. It's also emotionally, because you're saying to a person right at the getting ready, wham, you have absolute work. This is weight gain. Now, it's not gain, so just going to come off as regulate of fluid, and it takes an amount of time, but it's absolutely never and bad. So feeling like you're is literally to accommodate the water. I mean, it's all, and every woman who has a weight issue, it's their nightmare. So this is the point in my work with women ready for this before they start in their. I explain that we're going to ride this roller together, and I also I will remind them as often as they need that this is not fat. Finding the right treatment is another real thing that We Are Diabetes does so beautifully. As Janine points out here, no one understands diabetes. I tried person after person after. I went to the eating disorder center nearby. They did anything about it, and it just made me feel worse. Now, what we know, that was this experience, common experience, unfortunately. It's not, nobody can provide diabetes, called diabetes informed. There are around the country, and diabetes is happy to help people with appropriate care, but there's also, I would call it approximated care, which is whoever the treatment center is or whoever mental health is, partners up very active with the diabetes to learn about what the appropriate should be. So that's what I advise when specialty care is available. It's like creating the next best thing. Treatments. A little bit about how hard it can be to find it. I refer to diabetes-informed treatment, and of the lucky ones who went to a program of this kind, to many, many, many other programs not that kind, struggle, and landed at this where I couldn't get away with anything because they knew everything. In other words, they knew all the tricks related to type. I feel like this eating disorder is particularly isolating. Talking with someone who understands exactly what through it was priceless. And then with respect to treatment and recovery, one of the things that I think is absolutely most important for both the person struggling and the treatment team, both health treatment, diabetes treatment, is to remember that blood sugars need to happen gradually. It's need to happen gradually because it helps with some of the water retention severe, or because that with the process feeling to the person who's trying to recover. But as it's the only way to do this in a medically safe way. So what often happens, what Abby, with her quote, that, is that many once a day for recovery, they die a little bit too. And this has something, I think, to do with the perfection that so closely associated with both and eating disorders. So if they explain, hey, this happens to go really gradually, it has to go really gradually, they may dive in too quickly. What I can is that they were gradually bringing my blood sugar down. She's center, so that I would be safe. As soon as I get to my own devices, I would keep my blood sugar in the hundreds or under 100. Everything hurt. It wasn't just my legs. Here I was just myself. Go and get healthy, and then my body is rebelling again, doing the one that I hadn't been doing in the past. And her story is an incredibly dramatic, because described having nerve pain because sugar is too low too quickly from her neck all the way down to her feet, and she had flat on her back for the first 6 months of her recovery. Now it did go away. It did get, and by the time I spoke to her, she was describing herself. She was wearing. Said, these were telephone interviews. I used to have, at that time, these big clunky sneakers. Now I'm wearing 3 heels. And to her, that was like such a mark of the change. And she was like, and it even hurt. Which God knows I could never do that. It don't hurt. Next slide, please.
So that's a perfect lead into what I want to finish off my section with, and what Anne's saying is, you know, a lot of people, when you're in the process of recovery, it's really hard to believe that you will feel better and that things do get better. And so I want to talk a little bit about what the gifts of recovery are for me. And obviously I have a lot of them, but I wanted to stress two important ones today, is that I have a completely different relationship with food now. It's no longer my enemy. And it took a long time for that to happen. It was not like, 2 months into recovery, I was like, I am fine with everything. I mean, before I was in recovery, I was incredibly intimidated by cooking my own meals. I didn't actually know how to cook at all. And it really took a number of years for me to get to a point where I could buy ingredients at the grocery store and go home and make an entire meal. And it was very overwhelming at first, but I'm now celebrating my almost 10th year in recovery. And I actually mentioned to my husband the other day, I said, I think I rarely ever go into our freezer to get a frozen meal, because I'm always eating food that I've made for us. Like, I make all of our food that we eat. And I was like trying to explain to him how amazed I was at this concept. And then a couple months ago, I was like, hun, I just finished this entire bottle of olive oil. I used all of it for cooking. And it's funny he was impressed. He tried to understand, but it really didn't make any sense to him. But I think anyone who has had a disordered relationship with food can understand what a big deal that is. The other major gift of recovery is the fact that I accept my chronic illnesses, because there's more than one. I accept them because I want to live my life and I want to be happy. And I realized that I was spending so much time and energy being angry and feeling the unfairness of it all, that I was actually hurting myself. It was taking so much effort to be angry. And so it took a lot of therapy and it took a lot of soul searching, but I'm at a point now where I'm accepting what I can't change about my physical body, and it's a much happier space to live in. Anna, next slide, please. The other cool thing and great gift of recovery is my functioning brain. I was actually a little scared at first, in the first couple of months of my recovery, how much free space was in my head. I didn't know what to do with it. So I did a number of things as I got stronger and felt safer in my recovery. I got my yoga teaching certification, and I for a while was a full-time yoga instructor. I took a training course at the Red Cross, and I became a nursing assistant. And obviously, I moved back into my theater career. But after 2 solid years of recovery and then moving into my 3rd year, I was very interested in why there was not enough resources and information about diabetes and eating disorders. And that's kind of when I fell into what is now We Are Diabetes. But the functioning brain aspect is something that it may not seem like a great incentive at first, but man, once you realize how much capacity you have to learn again and how much you want to learn, it's very empowering. And with that last final thought, I spent a great deal of time running away from who I was. And the final gift of recovery is that I rediscovered me and what I want and what I love and things I care about. I could care about other things besides numbers and food and control. And that's freedom in a way that I cannot fully express. And it's a freedom that I hope to be able to share with many more people through We Are Diabetes. Anna, next slide, please. With that being said, I just wanted to let everyone know that WAD offers all of these services. And for more information, just visit wearediabetes.org. We will do our very best to find the right support for your situation and for your needs. And again, there's a lot more information on the website. I don't want to spend too much time making this a WAD promotion event, but I love the work I do, and I love helping people, and I am here for anyone that needs that help and support.
Okay. Thank you. Thank you so much, Anne and Asha. I really love this year's webinar series where we're having these candid discussions because we're having a professional, but we also have someone like us, a woman that lives with diabetes, sharing her story. So I really appreciate today's conversation on this webinar. We are out of time. Which is wonderful because the content is so wonderful. I want to thank you both, Anne and Asha. I want to thank everyone for registering and attending and listening through. And I'd like to remind everyone that in 2 weeks, we're going to have another webinar continuing the series. We will be discussing diabetes and kidney health. So join us on September 26th, that's 2 weeks from today, at 4 o'clock Eastern. Where you can listen to that. You can register on our website at diabetessisters.org. We will also archive this webinar, today's webinar, along with the slides that you saw on the screen, and they will be available in the next couple of days again on our website at diabetessisters.org. Thank you everyone for tuning in. I hope you have a great afternoon. Bye-bye.